Now I would like to welcome Jacek Barszczewski, who is working with the OECD as a health policy researcher with a primary focus on social protection for long-term care. So Jacek, he's joining us online. He holds a PhD in economics from the Barcelona School of Economics and the Universitat Autònoma de Barcelona, where his research centred on labour economics, family economics and migration, obviously all which I'm sure it will inform a lot of his presentation this morning. And his paper is entitled Situating Ireland in the OECD Landscape of the Long-Term Care Systems. So, Jacek, I will invite you to share your slides and begin your presentation. Thank you.
Thank you very much. I'm very sorry that I cannot be with you today in Ireland, but I'm very happy to join you online and present a little bit the perspective of the OECD, in particular when it comes to analysis of long-term care system in Ireland. So the big question in my presentation is, how does Ireland's long-term system compare with that of the other OECD countries? And I want to highlight two things in this question. The first one is the long-term care system. So to answer this question, first we need to know what is long-term care system, so what we actually want to compare, and then the second part would be how we want to do this comparison. So when it comes to the question what is long-term care system, there is no simple answer for this question. Long-term care system can have many dimensions. They cover a lot of aspects. And here what you could see on the slides is the word cloud, which present the keywords appearing in the OECD reports related to long-term care. As you see, there's a lot of aspects. So we have financing, we have quality, we have governance. So there are a lot of aspects. So to compare to long-term care systems, well, actually we are comparing a lot of different elements. So to facilitate the comparison, we organized the keywords which were presented on the previous slide, and we organized them into 5 main pillars which are building the long-term care system. The first pillar is access. So here we are looking, okay, is the long-term care system means tested? Is it needs tested? Is it relying more in kind or in cash benefits? The second important pillar is availability. So here we are looking at how many long-term care beds is available within the system, how many long-term care carers is available, but also what is the support for informal family carers. Another pillar is funding. Here we are looking at the cost of long-term care, which share of this cost is covered by the public social protection, what are the components from the user perspective, and what are the consequences of this for the poverty rate. The fourth pillar is governance. So here we try to look, okay, is the system centralized? Is it decentralized? Is the legislation unified? And how the system is integrated with other public systems, like healthcare, for example. And the last pillar is quality. So here we try to look, okay, what measures are introduced to ensure high quality of long-term care services provided within the system, and what are the quality outcomes. In order to measure all these aspects I mentioned, divided into these 5 pillars, the OECD collected the data on 20 indicators. And we are going to use these indicators to somehow describe the long-term care system of each analyzed country. So once we know what is long-term care system, once we define the space in which we want to do the comparison, so now the question is how we conduct this comparison. So how we compare, for example, Ireland's long-term care system with long-term care system in other countries. So there is a lot of ways of doing it. We can do it pairwise, one by one. We can compare to the average. However, we would like to, and I'm referring to the working document which we just issued in June. We would like to propose a new method. So, in order to facilitate this comparison, we propose to conduct the clustering of long-term care system. What I mean is to group countries with a similar features together. Why do we believe that it's the effective method in order to compare long-term care systems? First, because grouping enables us to compare clusters within, to do the between cluster comparisons, and this allows us to identify general patterns. So we would have a systems which would tend to have more public providers or private providers, or lower funding, or higher support for informal care. So this would allow us to have like a general patterns, but then we can also pick a particular country, for example, Ireland, and then, except of the looking of the characteristic of the cluster in which Ireland is located, we could also compare Ireland to other countries within the same cluster, which have similar features, but this allows us to find also some key differences. These two types of analysis, so comparing general patterns in the long-term care, but also patterns within the cluster, this allows us to identify the strengths and challenges. And what I'm going to focus today is the Ireland's long-term care system. So, what am I going to do in this presentation? First, I will try to answer the big question, which I showed at the beginning. So how Ireland's long-term care system is situated within the OECD landscape of long-term care systems. And to do so, I will answer first how long-term care system of the OECD countries are clustered. So what is the classification, which we did? What are the characteristics of the Ireland's cluster? How does the Ireland system compare to the other systems in this cluster? And finally, I will present the three key strengths and weaknesses of Ireland's long-term care system. So, a little bit about clustering. I don't want to go very much into all the nitty-gritty statistical details, but I think it's important to present the overall perspective. So as I mentioned before, we collected 20 indicators which describe these 5 pillars, so access, availability, governance, quality, and funding. And we collected this data for 29 long-term care systems. So 29 OECD, I think 28 OECD countries and 1 non-OECD country. We took this big database, we applied advanced clustering methods. So we were trying to look at the similarity in patterns between different systems. And we try to look if this given group of systems has enough similar patterns in order to form a group. And by conducting this exercise, we identify 4 distinguished models of long-term care provision in the OECD countries. So in this slide, I'm presenting the division. Here we have 4 clusters. Cluster 1s, these are countries that have the highest financial support. They have formal public provision, yet offer high support to informal carers and have a high quality, unified but decentralized system. Cluster 2 comprise of long-term care systems that offer high financial support, are centralized, rely more on private providers, and have less means testing. Cluster 3, I will skip. That's the cluster where we grouped Ireland. I will talk a little bit more about this cluster in a moment. And now I will just quickly go to cluster 4. So that's a cluster which offered the lowest public funding for long-term care, which results in low formal care coverage. And usually the long-term care systems are fragmented and offer usually lower quality of services. So that's a big picture of these 4 models of long-term care provision. And now I would like to go into the details of cluster 3. So in general, systems in this cluster, they very often use means and needs testing to restrict access to long-term care. When it comes to formal care, we see that the coverage is average, so it's below the coverage of formal care usually expected in countries in cluster 1 and 2. And the generosity, just also in contrary to other countries, actually the informal care provision is relatively low. When it comes to generosity, it's relatively average generosity. So the average share of the cost is covered by public social protection. When it comes to the long-term care legislation, it's often fragmented, and here I refer to the fact that very often long-term care systems they were developing in two separate sectors, in the social sector and in the health sector, and some countries built a unified new legislation which put together these two sectors or the elements of these two sectors. Which were responsible for long-term care, but some countries not. And in this cluster, most of the countries has a fragmented long-term care legislation. Usually, governance is decentralized. It means that it's rather local municipalities or regions are responsible for long-term care provision. And finally, regarding the measures to ensure quality of the services, countries in this cluster usually use staff ratio, minimum staff ratio, and the quality assurance rate. So these are the general characteristics of cluster 3. So now let's look how Ireland is performing in comparison to these characteristics. First, what we see in Ireland, we see that there is a needs testing. So on average, the support is higher for people with a stronger level of needs. However, there is no means testing, so the financial means, meaning income and assets, do not impact access to home care. Ireland is different from other countries in cluster 3, as it has a higher coverage of formal care, while the prevalence of informal care is relatively low and is similar to other countries in this cluster. Ireland has also a more generous system, so the public social protection for long-term care is higher than on average in the cluster, yet the legislation for long-term care remains fragmented. The governance is centralized. That's also different from what we see in cluster 3, where most of the countries is decentralized governance. And finally, Ireland has a quality assurance framework, similarly like other countries in cluster 3, but does not use minimal staffing ratio. So here, as you see, we conducted some comparison of the clusters. We first identified some patterns. Then we also compare Ireland within its cluster. And this analysis allows us to formulate 3 strengths of the Ireland's long-term care system. So first, I already mentioned it. It came across when we are discussing the differences. Ireland has relatively high coverage of formal long-term care services. So if we look into the details, we would see that in Ireland, and this is based on the survey data, we see that more than 50% of older people with long-term care needs receive formal care, and this is the highest share among all analyzed OECD countries. So this is really something which makes Ireland stood out, that the number of people, or the share of people who receive the services is very high. And this is, of course, correlated with the fact that the prevalence of informal care is relatively low. The second strength is the generosity of the Irish public social protection system. And if we look at the share of the cost, which is covered by the public social protection for older people with severe needs, medium income, and no wealth, we would see that more than 90% of the cost is covered for this type of person. And while it's not the most generous among all the analyzed countries, this is the data from 2022, just for the reference, it's not the most generous among all analyzed countries. We see that some Scandinavian countries and also countries like Netherlands or Luxembourg are covering nearly or basically 100% of the cost. The more than 90% still is relatively high share, which is definitely different than some other countries in cluster 3. This high public social protection, relatively generous public social protection, which cover high share of the cost, leads to the fact that long-term care system in Ireland relatively effectively reduce poverty risk linked to long-term care. What do I mean by the poverty risk? So what we are calculating here, we are calculating two theoretical scenarios. In one, when the person is not receiving public social protection and has to cover all the long-term care expenses out of pocket, and another scenario when the person receives the public social protection, and we compare this to and then for each of these people we are calculating the poverty risk, and then we compare the difference. And we see that in Ireland, this difference is around 70, not 17, that's much different, 70 percentage points. And while in some other countries, mainly the Scandinavian countries, which offers the most generous system, it's a bit higher, it's around 90%. Still, this is relatively good score, which allows Ireland to be among one of the highest scores among the OECD countries. The last strength which I would like to mention is the presence of a framework for monitoring quality of long-term care services. I have to say that most of the analyzed OECD countries have some kind of framework, but still it's worth stressing that this is a very important element. And not all the countries still have it, even though many of them is still working to develop it at the moment. After discussing the strengths, I would like to also move to 3 challenges. So the first challenge, which I would like to discuss, is the fragmentation of long-term care legislation. So as you can see on the graph, currently more or less half of the country has a unified long-term care legislation, while in another half this is still fragmented. Why is it important? It's important because fragmented long-term care legislation might lead to inequalities in access and coverage, unclear financing mechanisms, and fragmentation of responsibilities. And what we are currently observing is that more and more countries are trying to move towards more unified legislation as long-term care needs are on average growing and more people require care. So in order to strengthen the long-term care system, they usually also try to unify the legislation. Another important challenge is lack of long-term care integration. So the integration of the long-term care system with hospital. As we see here, there is also no, it's not all the countries have integration of the long-term care system with both primary care and hospitals. This is a case in more than 40%, while 25% of the countries have no integration at all, neither with primary care nor with hospitals. Ireland is here in the middle group. There is some integration with the primary care, but it's missing so with hospitals. And this is important because it's this kind of lack of integration may lead to the fragmented care pathway and misaligned incentives and financing. Regarding the integration, I would like to mention that currently OECD is conducting the project with Ireland. The project is financed by the European Commission. And the idea is to create a multidisciplinary workforce model for integrated care. And this is a very important step which can strengthen the integration within the long-term care system and be very beneficial for people who are receiving care. The last challenge which I would like to mention today is the currently existing limited requirements for home care providers. However, from our desk research, we are aware that currently this is a topic being discussed in Ireland, and in November last year, Health Information and Quality Authority issued a draft on national standards for home support services. And we believe that this is a very important step because, as you could see from the graph, most of the countries have mandatory accreditation for residential care services. So when you have the group either and both, these are mostly, basically all the countries will have accreditation for residential care. Very few countries have no accreditation at all. But as we see, there are still a lot of countries which do not have accreditation system for home care. Because we are now, because many countries are trying to introduce policies which tends to deinstitutionalize your system, so to decrease the importance of the residential care and increase importance of home care. Setting the standards for home care providers is essential to ensure that the high quality of services will be maintained. So this is my last slide. These are just a couple of key takeaways from my presentation. So first, if we want to analyze the IME long-term care system and conduct some international comparison, this requires a clear definition of what constitutes a long-term care system. And then within this definition, we need to collect a set of indicators which are describing long-term care systems. Then to facilitate the comparison, we conducted a grouping of countries with similar characteristics. In this grouping, Ireland was clustered together with Canada, Estonia, Hungary, Italy, Latvia, and the US. And using the grouping and within group and across group comparison, we identify Ireland's system key strengths, which lie in the generous public social protection and very high coverage of formal care services. But we also identify areas of improvement, in particular room for improvement in integration and long-term care integration. Thank you very much. Here you see two QR codes. The first one is to our website on aging in long-term care, while the second one is the QR code for our working paper from which data and the analysis which I today presented are taken from. So if you would like to learn more details and you also would like to learn more details about other countries in the long-term care system, I really encourage you to check our paper. And of course, if you have any questions, we are more than welcome to contact me or my other colleagues directly. Thank you very much.